Go.
Hi there, everybody. Good evening again. Dr. Baier here with Equipped, and we are going to dive into a big kind of head to toe screen of everything we know to be important for horseback riding, and probably some things you didn't know that is going to be tucked in here. But I will explain how each element relates to riding, and also certain exercises, ideas that you can come back to and start doing now. We're in spring right now. Hopefully spring is really here, but it's also something I want you guys to keep in mind for next spring, because that is, you're dusting off from maybe not riding at all or minimally or inconsistently. And this is a really great screen for making sure you don't have any injury risk sneaking in there. And then also you want to make sure that you just truly are in the best shape possible for your horse. So you could do this as much as you want, but for sure, when you know you've been waiting to ride consistently and you know you're going to get back into it. So I'm going to just dive in. Oh, and I will mention for people who haven't heard yet, this would be great to stop, pause, and ask questions. I'll stop at the end of each little fitness screen element and, ask for any questions. And you can unmute yourself. You can pop up on video if you'd like, just knowing that this is being recorded. And then we can answer questions along the way. Okay. So what is functional movement screening? So while I am calling this the equestrian movement or equestrian fitness screening, this is actually taken from an organization that has a really big reach in the world of personal training, athletic training, all kinds of fitness individuals from a rehab perspective and just a fitness perspective use this. It is called the functional movement screen. And each one of these movements we're going to do, or these little test items, would be scored. I'll roughly show you how you can score yourself if you'd like to do that tonight, but we get trained through a weekend course on how to score this correctly and accurately, and then your score is what determines how at risk for injury you are. And this functional movement screen came out of the NFL. It was a tool that they wanted to get all the players of the whole team through quickly and also effectively to say like which players they really have to watch or work harder on to prevent injuries. And you may be going like, I did not sign up for like an NFL screen tonight, but you'll be surprised at how seemingly simple these movements are. They all can be done with slight modification if you do have any major injuries or just concerns that you don't want to push something too far. But to give you an example, when I was going through the course, the instructor, we were all physical therapists going through the course, and the instructor was saying how she had not seen anybody score a perfect score except one physical therapist she was doing it for came really close. And on one item, like one test item, you have to you're on your hands and knees and you have to touch your knee and your elbow together. And the lady couldn't do it simply because she was just pregnant, but she was about to perfect the test. And, yet all these collegiate athletes, professional athletes are failing it and are at risk for injury. So it's not that you have to be some rock star athlete to do well on this. It's truly about being well-rounded in what you bring to the table in terms of flexibility, strength, coordination, and balance, and being symmetrical right to left. So that screen, that's a little bit of the history of the screen. It's now been applied to all sports. I even found, this is so cool, again, to see research starting to tap into the equestrian athletes. I even found 2 studies about the FMS, or the functional movement screen, being put into the equestrian world. So it was with college aged riders, but nonetheless, that's the start of research for us. So that's great. And also it's gotten into like police, firefighters, military. So it's a pretty cool screen that can be adapted to a lot of sports or lifestyles, if you will. So the big thing with why it matters to us as horseback riders, it's why every lecture I've done these past few weeks has mattered. We can't be, hypocritical, as you will. Like, I don't want to ask my horse to do something that I don't have the ability to demonstrate, or at least sufficiently demonstrate. So I want to be even in my upper body and in my shoulder flexibility if I want that in my horse. I need to have good breathing mechanics if I want my horse to have a pliable and flexible rib cage, so on and so on. So why this matters then more specifically is because we don't want to get hurt. There are times where we are going to have a fall or a freak accident, and something like that does create injury risk or injuries. But I don't want it to be just, these little things that creep up. And by the end of summer, you're like, I can't ride. Especially for those that do this professionally. This is a big deal. This is their livelihood. So we're going to take a look through each item. And then if you have like a little sheet of paper or your phone and you want to track your scores, you're welcome to. I'll talk about that scoring system. And then at the very end, I'll talk about potential ways to take this material and what you can do next with it. Oh, wrong button. Okay, so this movement screen, I talked about how it's very, very standardized. That's why we have to get training to score correctly. You guys are going to score based on 5 seconds of information on the scoring system, but we take a lot of time to do this well. The cool part about when a certified professional does this is the score we put in, whether it's their computer, their iPad, their phone, there's a great program that takes your score and then spits out a workout routine for you specifically based on your score. So it's a very quick thing to do. And I really, really encourage people to take the time to, if you want to know what your score is and you want to get your own personalized routine off of it, definitely let me know, because that's something we can do virtually like we're doing right now, or in person if you're in this area. So last thing I'll say is just please go through it with as much vigor as you'd like, or as much caution as you'd like today. Because when I do this with people face to face, I am saying, time out, hold on, that trying this test is going to create an injury. So just listen to your bodies tonight and don't get too aggressive, but do try your hardest that you feel comfortable with. So this is the scoring system. Let me make sure I'm not blocking anything here. So first things first, if you do a movement and you have pain, you get a big fat 0. I don't care if your form was great or kind of okay. If you have pain of any sort, 0, because the biggest risk, and I should say, you're trying to score as many points as possible. So if you get a 0, obviously your risk of injury is pretty darn high in the movement you're doing if you already have pain doing it. So that is a 0. I will say, just because something is, a little stressing to an area, like you feel a strong stretch or you feel a strong muscle contraction, that's okay, but you define what pain is for you. I could do a whole lecture on the definition of pain and how we treat pain, but truly, real simply, pain is your perception of threat. So if something is a strong stretch and you don't perceive that as threatening, you're not going to call it pain. But if you're like, oh, that hurts, that is your brain's perception that it's threatening. So that's how you're going to define pain tonight. A 1 is if you can, you really are kind of hacking your way through it. You just barely are trying to get the movement done. You lose your balance. You're truly either unable to do the movement. You don't have pain, but you're unable to do the movement, or it's super, super sloppy. And then a 2 is that you're doing the movement, but you're doing some compensations. And this is where a physical therapist or someone trained in doing this test can spot those compensations like a hawk. I'm going to point out the most common compensations that I see during each test item tonight. You're not in front of a mirror, so you'll probably have to self-judge a little if you want to, somehow on your screen fit your own face to watch and get some feedback. You could try that. And then if it looks good and you don't have any compensations or cheats, everything looks even right to left, then you give yourself a 3. So that's the goal, is that we get as many 3s as possible. As long as your score is 15 and higher, you have fairly low risk for injury, which is great. If it's a 14 or less, there's some risks for injury. And that's where you want to, more seriously talk with whatever professional you're working with to just make sure that doesn't come to fruition. So the 2 studies I found on this, they were, like I said, college age riders, and then they did also with show jumping. It was the same author, this I can only imagine in the same group of riders. They had novice show jumpers and then advanced riders, and they based on jump height. So the novice riders were twice as likely to have an injury compared to advanced riders. And the same vibe here is that people then who aren't riders compared to the riders, and again, it was all collegiate aged kids, young adults. So if you're riding, you're doing a pretty good job at staying fairly well-rounded compared to non-riders who are 1.5 times more likely to be injured. But when they looked at all the scores, the average scores based on all of the sports that there's research on, riders don't fare too well. So I think that's just what I want to say is, like, good job for us. And, if you're becoming really quite excelled and talented at the discipline you're doing, odds are you're probably pretty good. But if you are just starting or kind of in that intermediate stage, there's a lot to still learn. And this is a screen that can help you keep learning and not have to slow down due to injury. I also found it interesting. They noticed a lot of left rotational deficiencies. There's some of these tests are, you get a score for your right and a score for your left. And then that left side being deficient sort of makes sense with right side dominance that we tend to see. But the rotational differences really goes to speak to, like, right hand dominant people tend to have really good right rotation in the rib cage. So rotating left becomes more difficult. And maybe for those that did the breathing talk, you could remember that it was like easier to breathe into one lung more so than the other lung. During some of the different stretches that we've done throughout, like our hip talk, maybe you noticed there is that difference right to left in your ability to rotate. And rotation is wildly important, as I'll get to later, in the riding world. It's a really, really potent cue for your horse if you can master rotation in your body. So we are going to cover this piece already. You can read the bullet points, but we'll carry on here. We're going to dive into the first one. And what I'm going to have you do, like I said, if you can make me as big as possible. If it's not working out, I can always stop my screen share and you guys can then see what I'm doing in the big screen. But you're going to start by standing and just grabbing your dowel or whatever dowel-like thing you have. So maybe that was a broom or a dressage whip. At this point, it doesn't, and it's fine if it's a little flexible. It doesn't have to be a full wooden dowel. I'm going to move this a little bit so you can see once I squat down a little bit more. So this isn't any Joe Schmo squat here. This is like a real deal full depth squat, as you can see in the picture. You want your butt to end up lower than your heels. But the more important aspect here, go down as far as you feel safe to do. But the bigger aspect here that I think more often than not people fail on or don't score a 3 with is because they aren't able to keep their trunk upright. This dowel starts up over your head and it needs to stay up over your head the whole time you squat. If you find yourself forwards on an angle or or someone like laughing at their ability to do this. So if you find this dowel is kind of coming ahead of your hips, that is a sign of stiffness in many different places potentially. But so we'll start from the front view. Again, if this is your squat, if you stop at like a half squat, great, that's fine. From the front view, you want equal weight on both feet. We don't want our knees to pinch out or bow wide. We really want our knees tracking centered over like our shoelaces. And then, so from the front view, something like this would give you a score of a 2. A shift of your weight would give you a score of a 2. You know, I don't know why you'd be crooked in your arms, but being crooked in your arms would give you a score of 2. And then from the side view, any type of leaning forwards would give you a 2. But if you can keep yourself truly, truly vertical, that's the goal. Now, for those that have that little plank 2x4 option, this is kind of fascinating. So let's say you could do it, but you find yourself leaning forwards. Like you can get your butt below your knees, but you tip forwards. If you have this plank, just trying to check if it's in my screen. Let me move my chair. So this is the dowel right here, this gray thing. Put your heels on it. And then try this again. And coming in and out of that position, staying more vertical, might have been way easier. So again, just your heels on it as you sit into that squat. Or maybe you do that and some of the discomfort or stress or difficulty goes down, or some pain goes away. So 3 would be even right to left from the front, your knees tracking centered. And from the side view, your butt gets below your knees and your arm stays perfectly vertical, kind of directly over your hip or over your heels, if you want to think of it like that. A 2 would be something where your knees did something funky right to left. Maybe you leaned more on one side than the other, or you had that forward tip in your torso. So those all would be 2s. 1s, I would say, would be like, you didn't get your butt below your knee, not because it hurts, you just didn't have the strength or the balance to do it. And then of course a 0 for anything with pain. This is a huge screen of flexibility. Obviously the shoulder has to be flexible enough to reach straight up in the air. Your rib cage, if we can go back to remembering that, like when we slouch and try to reach, our shoulder space is only so big in the shoulder joint. So we needed our rib cage to reach into extension to be able to go all the way up. So having some flexibility of the rib cage is really important. And then the hip joint. So this is where I think for riding purposes, especially those who jump, you can see how if you took a squat and like tipped it on a 45-degree angle, that's roughly what being in your 2-point is like. So having that ability to hip hinge is so critical to take stress off the lower back. And here's the other piece, the ankle flexibility. For those who had the board, and when you were on the board, you felt like it got easier to kind of drop into that squat without tipping forwards, that's signifying ankle stiffness. So we're going to do a quick screen for ankle stiffness that's in the newer version of this functional movement screen. They updated it a couple years ago, and so we'll do that next. But I find that really interesting. You can tell by how someone squats how stiff their ankle is. And of course, in any discipline of riding, having that shock absorption of our ankle is pretty critical. The stability for any of you who felt a little off balance doing this, trying to be so vertical, that is what shows a lot of ankle instability. If you can't balance in this deep squat, it really highlights the need for balance within that ankle strategy. But then also some of your really low core muscles have to kick in as you're balancing too. If you could bring your arms down, it would be easier. If you could hold on, it'd be way easier. But the fact that your arms are overhead and you can't hang on to anything solid makes this a really big balance challenge. So any questions on doing this? And then we're going to talk about exercise ideas of how to make this go better if you did not get a 3. But any questions on actually performing it? You're all on mute, but I hope no one fell down. I'm like, I didn't hear anything. And then I'm like, they're all on mute. So if you are by something that you can balance with, oh, I want to do that ankle screen, that ankle flexibility screen. So we're going to go all the way down to my feet. So this is just a flexibility test, but the ball of my ankle is going to be the goal of, can I put my, you're going to stand like this, not on a tightrope, one behind the other, but just offset. And then I want to see, can my back knee, I guess, the one further away from the camera, can my right knee go past the line of my ball of the ankle on the front leg? So if I did, let me just switch. So the ball of my ankle is right here. And can I get this knee past the ball of my front leg ankle? I'm just going to stay in this position so you guys can see what I'm doing a little bit. Can I get past, with this left knee, can I get past the ball of my right ankle? If I can only go this far, that is just considered a fail. You'd get a 0. And if I can go past the ball of my ankle, that's considered a pass, and that would be a score of a 3. I'm sorry, these don't, this little piece is just a pass fail. Sorry. And then you can switch, see how the other ankle does. It's not uncommon that one ankle has more motion than the other, and that would somewhat determine why maybe you'd be shifting right or left. You're going to go to the ankle that has more flexibility instead of feeling even hinging in both ankles. Okay, so now what do we do about our not so great score if we did not have a great score? So the first thing I really like to have people do is take out the balance. So take out balance altogether by just doing what's considered a hip hinge, or what we might know as like child's pose stretch. But we're going to modify it just a little bit. You're going to be on your hands and knees and just simply practice hinging at your hip. And as I'm doing this, you can imagine this is sort of like me squatting below my butt, below my knees. And I should be able to get pretty darn close to sitting on my feet without having any assistance from my lower back. No rounding or tucking of my pelvis would need to occur. And I can just hinge, 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 hinge. Now, if I were to go into true child's pose, I would flex in my lower back and I'd have some stretching in my lower back. But you can also see how this is starting to support that arms being overhead position. So going all the way down starts just giving you a really nice stretch to your mid back and to some of the muscles, like your lat muscle that comes down from the shoulder blade to the pelvis. So I start this with just hip hinging. And once I know I can hinge with a totally still spine, then I go down and get my upper body stretch. So I'm taking 2 of those elements of the squat and I'm working on hip hinging and that overhead flexibility. Now, what's really interesting is if I like imagine I'm on my hands and knees here, hip hinge, hip hinge, hip hinge. And then this is the overhead part to it. But if I tend to lean forwards, but if I hold on, and now I can go like no problem because I'm holding my table, that's a balance issue. So again, if I could hip hinge just fine and child's pose stretch just fine, and now I'm doing it on the ground and I'm going, oh, why can't I get so vertical? Hold on to something. And then you'll find, oh, now I can do just great. That's a balance issue, not a flexibility issue, but a balance issue. And perhaps your balance is poor because some muscles are a little weak, or they're just ill-equipped to respond and react quick enough. Balance is somewhat of a strength challenge. So you can use your hands for a squat and really just practice. This is not that you have to go down to the bottom of this deep squat every time, but when you practice squats, practice with holding, because when you hold a surface, you might be able to feel better success at getting lower and gaining strength in a new range of motion, that if you weren't holding, you'd like, nope, I'm not going there because I'm going to lose my balance. So if you're holding, that can help. One other thing you could try is hold, stay down in that squat. I'm just going to use my chair as like a quick example. So I'm going to hold, go as down low as I feel comfortable doing. And then I'm just going to let go and hover. And then I'm going to go back to holding. And then I'm going to let go and hover. You might feel all the muscles in your feet and ankles kind of wake up a touch. But that's the one place where you can practice that balance just intermittently, just for a couple seconds, and then go back to holding. It's sort of like when I have riders post the trot and then stay up for 2 beats and then come back down, or sit for 2 beats and come back up. Like I'm just tinkering around with their balance a little bit. This is one that I would suggest doing if you don't feel you simply don't have the strength. This is not a very strong band, but it is brightly colored, which is why I chose it. But if you can imagine taking this band and tying it around a pillar, a tree, you could do it around, depending on like how your stalls are set up, you could put it on a certain aspect of like the door or a blanket hook, but have it behind you, like tucked right under your butt cheeks. And then when you sit into the squat, you have like this little comforting hold, if you will. I can't do it because this is too low, but another place to put it would be like right on your pelvis, like your belt line. And then have it again to just sit into. And that's one way of feeling a little bit more of like an assist to go lower and lower into that squat. So that is another place where a touch of exercise equipment helps people feel some strength. And I like that one a lot. I like that one a lot for people that I know have the strength, but maybe don't have the confidence to try their strength. And they just need that psychological belt or that psychological band support to sort of trust into that deeper aspect of the squat. Okay, so biggest thing here was hip hinging, child's pose stretch. If you can't kneel or have that much knee flexion, just do hip hinging, like standing on the edge of a counter and sit back, hinge back, stretch with those arms up on the edge of the counter. And then the idea of that balance is quite important. So on and off letting go, or notice if I hold on, can I do this surprisingly a lot better? Well, then I need to be doing some aspects of either support with the band, or just on and off finger, like hold and then let go. I'm saying like 5 seconds, nothing too grand, and maybe 2 or 3 repetitions of that. Okay. Questions on squat exercises. This matters as it relates to posting mechanics, especially for those that ride in any type of half seat position. You're like incessantly in a squat. But even if you're riding a touch more upright, this is where this type of squat is really, really nice to sort of show how strong am I in this type of hinging setup. On to a hurdle step. So this is why we have 2 chairs. You can see in the picture, this is like the real deal fancy kit. Has 2 little posts and then this elastic band that goes across right at the height of your tibial tuberosity, or the knob of your shin that's right under your kneecap. And that's going to be the height that we're aiming for, which is why I wanted that chair, and you're going to rest the dowel on the edge of the 2 chairs. I'm going to talk about it just briefly, and then I'm going to go set it up. But when you do this, having that dowel either rested on the shoulder or straight up overhead would be an even greater challenge if you'd like. But having that dowel there is really just a good visual for any tipping and leaning of the upper body. So if you want to have your arms like out and available in case you do lose your balance, you don't have to have that dowel there just for the sake of your own safety. But you're going to step, touch your toe, just your toe on the other side of that dowel that you're using. You don't have to put your foot down. You don't have to put weight on that front foot. It's just a toe touch and back. And then this will be where you score your right leg and then your left leg. And it's whatever leg is standing is the one you're going to have receiving the score. So obviously a balance exercise, but also a range of motion exercise, a flexibility challenge that's a little bit different than the squat. When I was squatting, it's what's considered closed chain movement. So how much can I flex my hip with my feet on the ground and then my pelvis closing? Well, this is saying I am testing the flexibility of my hip as my foot's off the ground, my thigh is moving and my pelvis is steady, versus my thigh is steady and my pelvis is going to move. So just a difference in what aspect of the joint creates movement, but either way, it's a hip hinge challenge. So I'd like this. It's the same thing at the ankle joint. So the hip, knee, and ankle all have a similar test and flexibility in terms of how much range of motion they need, but a totally different way of moving. And I'm going to ask you guys this. Do we think riding is more closed chain movement, so squatting, versus open chain movement, like this, reaching your leg up and putting it, touching it and bringing it back? And just kind of think about the mechanics of how you use your leg. Is it more closed chain, steady foot, moving body, or open chain, steady pelvis, moving leg? And hopefully you're going, well, it's kind of both, because that is correct. The first and the second test are really, really rich in terms of flexibility assessments. And I can't pick one being more important than the other for riding, because to have a steady pelvis and to move my leg to talk to the shoulder or the front of the rib cage or the back of the rib cage or the hind end, that's all different leg placement. And then all the rotational abilities we want to have off of a steady pelvis. But the moment I post, now this is closed chain movement where my foot is steady in the stirrup and I can move the rest of my body in relationship to that steady foot. Okay, let's try this out. So 2 chairs and your dowel. Okay. So the idea being your tibial tuberosity. I'll show you here. Is my bottom of my kneecap is right at this point, and your tibial tubercle is right here. So I'm talking maybe an inch below your kneecap. So as long as the chairs are roughly, just below your knee, that's great. If it's above your knee, well, you're just being an overachiever and you're probably going to get a complicated score. If you're an underachiever, that's okay, because we're making this work for our home use. So standing straight, watch or perceive your pelvis and how level it's staying. As you, again, arms are going to be resting with that dowel in my imagination. So I'm just touching here so I can feel my shoulders. And then you're going to go up, touch the other side, and come back down. And then same thing on the other side, touch. And if you bump this, it's considered a 1. If you bump this, that's you not doing the movement. So if you bump it, that's a 1. Things that would be a 2 would be a big tip of my upper body or a big hike up of my hip. I have to bow my leg in or out with my knee to get around it. And then lastly, if you can see my ankle, this hinge of my ankle, a lot of people turn their toe in or try to toe out, but it's really got to be that toe coming straight up, not like that. I have like black on black going on, but this toe movement, people will often sneak that in. So their hips are level, their knees good, and then their toe does something funky to get over the dowel. Lift your toe straight up and then touch and straight up with that toe. So a lot of these deviations are from the front view. A tipping shoulder, a hiked up hip, a rounded in or out knee, a toe that's turning in or out. Those would all be signs of a 2. If you bump the dowel or you can barely do this without holding on, that would be a 1. And then I'm going to show you one thing from the side view that I see. When people do this reach, so if you can look like where my white and my gray are, right at that pelvis angle, if you can do this reach and keep your pelvis level, you're doing great. But if you're doing this reach and you get a tip and a tuck of your pelvis, like a posterior tilt, that means your hip joint said, I can't give you anymore, and your pelvis said, I'll tuck and give you the rest. Well, that's a compensation. Some people even have an arch of their back, like an anterior tilt of their pelvis. So I really want that pelvis just riding steady, nice and neutral the whole time you're doing this hip movement. So maybe for a repetition, take your hands down onto your hips and try to feel if you're getting any of that forward or posterior tilt as your hips are doing their job. This is a tough one. This is a tough one because a lot of our movement, and we squat down to pick things up, as we walk and plant our feet and have stability on our leg, a lot of our daily life movements are more closed chain. But lifting this leg and touching it down, that's open chain. Think about, the balance and stability we need to have, putting one foot in the stirrup as we swing the other leg around. I also feel like this is really important as it relates to kind of holding, let's say, your inside leg steady at the girth, and now move and have a varied use of your outside leg placement. So there's a little bit of this dissociation from my right to left side with both closed chain steadying and open chain moving. So I love this exercise when I see people really struggling as it relates to kind of having 2 different roles with the right and left side of their lower body. And if the right or left leg is struggling at their job, where do I see it show up? Is all this funky trunk leaning. So when you see people kind of motorcycle turning around their circles, I will often get really picky about how great the stability of the inside of the leg, the inner leg needs to be, the inside leg, I'm sorry. Yeah, we have a question. Go for it.
Hi, so I can get my foot over, but I seem to have a hard time bringing it back. Is that
just the foot aspect of it?
Like the whole leg,
Okay.
So I can go over and then it's like, oh, you really have a hard time coming back.
And did you only touch your toe, or did you have to put your full foot down on the touch?
I put my foot down. I had to put my foot down.
So I would look at that like your standing leg, the posterior muscles. So everything from the muscles that are your paraspinal muscles to your glutes, to your hamstrings in the back of your calves. So I'm going to use my right leg as the one that needs to stay put. If my left leg touches and I give and put full weight there, all these posterior chain muscles got to take a break. And if they are truly doing their job, they're really working, volume down, volume back up, but they never shut off. Okay. So it's like that little adjustment of working, but on a volume dial instead of an on-off switch.
All right. I'm going to go back at it.
Try just the toe touch. Yeah.
Okay.
But that's a great question, because it goes to show, like, we need to use our muscles with this these small little scales of turning on, turning off. One side's turning on while the other side's turning off slowly. But it's not these big light switches where it's like, boom, shut off, or wow, turn on. You kind of want to have some on and off to it with control. Any other questions off of this hurdle step?
Can I go back to the previous one real quick?
The squat, yeah.
Okay, so with the squat, I had to do a 2 because I was definitely leaning forward, but my ankle stability, and I can do the hurdle step just fine. It feels like it's my thighs that are tight.
When you say thighs, you mean the front of the thighs or the back of the thighs?
The back, the glutes.
Oh, okay. Yeah. So the leaning forwards and feeling like there's a lot of pull within the glutes as you do it. That's what
and I find myself, which I do in the saddle too, is I want to close my upper body all the time.
Yeah. What if did you try hanging on to something and seeing if you can squat more vertically?
It seemed to help a little bit, but I still feel that pull in those muscles really bad.
So there's a lot of connective tissue that is creating a little bit of support for us. And if you think about like all the lower back muscles, they connect to a big sheet of fascia that connects into your glutes. So this whole area here, and then it goes down and it connects into your butt muscles. We saw that with some of those myofascial chains.
Okay.
So that could be certainly what you're feeling, pull and stretch, because you're fully stretching your glutes. And then when there's this forward angle of your trunk, you're probably feeling that pull and stretch along your glute muscles and some of that myofascial tension into the back. Now, why you're choosing to hinge forwards is if it's not your ankle, so the board didn't make a difference.
No.
Flex your hip totally fine in the hurdle step. The last culprit is your thoracic spine right here.
That makes sense. Okay. And that's right. Okay.
Yeah, that's the next piece of why I can't come more vertically, is because you just have this, from chronic tight slouchy posture, you have tightness in your diaphragm, tightness in your pecs, and stiffness in your thoracic spine.
Okay, that makes sense. Okay, well, I'll see what you say about that in a little bit.
Great. No, these are good questions. I'm sure people run into this stuff. And this is where a lot of on-the-fly diagnosis can come in to play, which is helpful. So I would then look at this and say, like, oh, I'd want to check your thoracic spine more so than I'd want to check your hip. And it rules out a lot for me. But this is not the place where you rule in something definitively. That's where you go and you get a physical therapist, truly, purely assessing that area of struggle. The next one, and these first 3 are the richest in terms of, like, they check a lot of things off with each test off the list, and they have a lot of, I gotta back up. They have a lot of exercises that come off of them. So we're taking our time on these first 3. With this hurdle step, if you struggled with it just simply from a balance standpoint, I want you to go through the balance progression. I'm going to show you with my hands because it's just going to be nice and close to the screen. So if you have a hard time standing on one foot as you do this hurdle step, then what I'd want you to back down to is, can you stagger your stance? So not like a tightrope, but a plank. You're walking the plank. Can I stand heel to toe, but a foot width apart and just balance? Can I do that with head turns? Can I do that with airplane arm rotations? Can I do that reaching up and down? So in that staggered stance. And can I do that in each foot position? And then I would go to being kind of that heel to toe in line and do the same things. Can I turn my head? Can I rotate my body? Can I reach up? But those are simple balance progressions before going to one foot. And then if you recall, when we did the hip talk, there's that star drill exercise. I like that because I'm on one foot, but I'm only, toe touching on these little star patterns. So for those that didn't see that, that's standing on, forgot that was there, standing on one leg, touching out on these 5 angles. So that's starting to work on just the balance component of why this hurdle step is hard. But then there's this whole aspect of the control of reaching this knee up while being stable here. And this is where I think a lot of people don't realize how weak their hip flexors can be. Hip flexors always are like tight, 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 tight. Well, very often in chronic tightness lives weakness. So we're going to go into this half kneeling position and practice. Oh, I'm sorry, tall kneeling, and we're going to go into half kneeling. And this is the nice place where you can practice activating your moving legs hip flexor muscle. It's a contraction of your hip flexor as you're staying stable on this down knee. And this is tricky. This is really tricky. And it's hard too if you, I do like this to be on like, if you're using carpet or a yoga mat or something like that, having a sock, because your tread of your shoe, it's critical distance that you really want to have not filled with something sticky and rubbery to catch. So trying to do this with a sock would be helpful too. But just practicing this move without what I just did, a big giant hitch in your balance. So trying to stay as straight as you can. I'm doing this on my weaker side as I pull this up. And then pelvis steady, not hiked, not tipped forwards, not tucked under, but just level in the pelvis. This is all good. Balance for your hip, and then hip range of motion, core stability. I really, really like this exercise. Let's say you're like, I'm not going to work out, Allie. I just don't have the time. Which is like, let's be honest, most of us don't want to work out, or we know we should, but we didn't get to it and we're busy. You can at least practice this, this knee hike. So this lifting up, I would watch the center of your knee, like it had 2 little eyeballs. Every time you pick your foot up the stairs, imagine those little kneecap eyeballs, and where are they looking? Are they looking in? Are they looking out? Or are they looking straight up that step? Because that way, you're at least at minimum as you do that step, doing little mini versions of this. Steady on one leg, moving the other, without a deviating set of eyeballs. Keep those eyeballs looking straight. And then if you're like, Allie, I live on a ranch, I don't even have stairs. Then when you get on the mounting block, you can do it. At least you can pay attention in those couple opportunities. So all good options to work on these concepts that the hurdle step brings up. This lunge, you can see they're on the plank or the 2x4. If you don't have that, imagine something, about 4 inches wide. That's going to be the wiggle room you have. It's about the width of most people's feet. And then you're going to go down as far as you feel comfortable. So a lot of people won't go down and touch their back knee down to the floor. They'll go down, a third of the way or half of the way. And that's fine. There's so many other elements that you can test yourself on, but then again, you'd be getting a 1 just because you aren't able to complete the traditionally desired movement. This movement we do the most in life. When I go to pick something up off the ground, if I go to grab like a hoof pick from my grooming kit, I'm not squatting, I'm lunging a tiny bit. And it's such a cool time to watch that knee tracking, because you do it so many times. When I go down to grab something big and heavy, I'm going to squat, but it's all those little things you pick up during the day that are, knee height and lower. Those are all lunging opportunities. There's a lot of side to side balance here too. So this is a great one because we have a right score and a left score to compare your sidedness. And then there's a big ask for flexibility on your anterior chain muscles. So not the posterior ones I pointed out before, but flexibility of your abdominal muscles and your abdominal fascia, your hip flexors, your quads, the front of your inner thigh muscles. They all get stretched when they're that back legs position. So let's dive in. If you have the board, wonderful. There's an aspect of setup here that requires you knowing the height from your shin to the ground. So you can take your dowel and roughly estimate that. And this is the distance your feet should be apart. The reason these kits, the dowels that I have has inches on it, and then I'd be like, oh, I'm a 16-inch, and then I have inches on the board, and I put my foot on 16 inches, and then it's all good. But you can do your best to roughly estimate it. So again, take your dowel, get to that tibial tubercle, that bump under your kneecap. That's roughly going to be the distance I want to have from my back toe to my front heel. Oh, you can't see my feet. So I start standing. Then what you do is you stay totally vertical with your upper body as you take your back knee and go and drop it down behind your front heel. If you can only go, half, so be it. But the intent is that you go right down and touch. And then the other intent is that your trunk stays vertical instead of tipping forwards. So that you stay vertical. That's the only side view goals. That you can touch and your trunk stays vertical. Your front view goals would be that as you drop down, that like this dowel, my spine is staying vertical. The gentleman in the picture is doing it because the dowel is available for his hands to be behind his head like this. And that's another way for us as the test examiners to see, is that dowel or the person's spine tipping right or tipping left. And then the other thing I'll say, go back to those kneecap eyeballs. Where is that front knee's eyeball set looking? So watching the tracking of that knee. So if you're like here and you're a little tippy, but you're holding your ground fine. If you're like doing the big side to side shifts, that's a 2. If that knee wiggles, that's a 2. If from the side view, you can get all the way down. I know I'm not in the exact position, but let's say you can get all the way down, but you're forward leaning, that would be a 2. The score is based on whatever leg steps forwards. So your right steps forwards, that's your right score. Your left step forwards, that's your left score. Any questions on this lunge? If you're doing it on just plain ground, you're probably like, yeah, that was tricky balance, but just giving yourself that little bit of a lift off the ground, this little thing you can fall off of, revs up your nervous system just enough that it really heightens your reactivity time, and it makes it more, I guess to me, it makes it like you have to handle your amount of nervous system activation to stay balanced. And that's sort of what riding is like let's get on this animal with a mind of its own, woo, and stay balanced. So it puts a little heightened stakes into the balance challenge, and we don't always perform well when our nervous system gets revved up. especially if you're quite off balance on a quite, wild horse, that certainly shuts down a lot of the relaxation and following capacity that we need to be good riders. So I do like being on the board because it escalates the scenario just a little bit. And I see how people handle that within their nervous system. Okay. On the dowel are these inches, and then you would place, watch my ceiling here, you would place the dowel at your crease of your wrist up to your longest finger, your middle finger, and I am at a 7. It's very often also your glove size. So if you happen to know that, that's 7 inches. And that is the length, or I should say that's the distance between my 2 fists that I can be apart and can be considered, that I have a good flexible shoulder and rib cage. So it's called your shoulder girdle, the joint of the shoulder blade against the rib cage, and then all the ribs on that side of the shoulder that we're testing. So I make a fist with my right fist being the one that's being tested, and I put it up, make a left fist, I put it behind my back. And this is where those 7 inches, really hard to do if you don't have someone testing you, but that would be considered, a good full complete amount of flexibility. If I can get within a hand and a half, so 10.5 inches apart, that would be a 2. If I'm beyond that, that's considered a 1. If I have pain, that's a 0. So what you guys can do, you can certainly try to perceive that, but very often we can feel the difference just within our own comparison. But you can, feel on your body and try to map out how many inches that is. It's important that it's 2 fists. Fingers don't count. Got to keep them fists. I don't know anyone who's ever been totally equal, because I have never met a rider who's ambidextrous either. So, so it's very, very common that we have our dominant arm on top is more flexible than our dominant arm behind us. Just because we use it more, that whole shoulder girdle and all the ribs tend to be more flexible. It's a really common place for people to be sore too, right? Just that chronic, low level, achy tension, just the place where we're like, well, of course we're sore there. That's just life. It does not need to be that case, but I get it's very hard not to carry stress and tension in this area of our body. But then how many times are we like harping on our horse for like neck tension, or their chest is tight, or they don't have enough shoulder reach, or their ribs are crooked and they don't bend the same each direction. So a huge place for being a good role model for our horse. This is also where, if you remember some of that nervous system, when we get into fight or flight or freeze, we can get into these kind of unknown reasons of why I always carry stress in these areas. So just a reminder on that, because I think that's such an important aspect of, why can't I do this? Well, it's not just mechanical and structural. There's an aspect of that role of stress within our nervous system. Any questions on the shoulder screen? So within a hand length would be, within it would be a full score of 3. A hand and a half would be 2. Beyond that is a 1, and pain is 0. And you'd score the hand that's on top. Oh, wrong button again. Okay. I have yet to find a horseback rider that can't really do well with this one. So if by this time in the test you're like, I am really not doing great, or you're just like kind of unenamored with your abilities right now, this will give you hopefully a confidence booster. The people that do struggle with this test tend to then have some other version of athletic activity that they do at a fairly high level and fairly consistently outside of riding. Like they're really into running or weightlifting or CrossFit or, you know, something of that nature will change this. But the straight leg raise, this is one where you lay on the ground. So do kind of watch, or we'll do instructions first and then I'll go on the ground and demonstrate it. The tester, the gentleman with the red polo shirt, he's holding the dowel halfway through the length of the femur. So halfway between the widest point of the hip, the widest point, to the knee. So halfway on this thigh bone. And if you can get that heel, so the ankle, judged by the ball of the ankle, past that point, you have full flexibility in this test. So I'm going to come up on my table. So you can just imagine the dowel, or you can set it there if you'd like with your hand. And then you're going to lift and see, can I get the ball of my ankle past this dowel? You could totally cheat. So try not to cheat. Keep that dowel as vertical as possible. If you can only get your knee past it, that would be a 2. If you can get the ball of your ankle past it, that's a 3. If you can't, you know, even get the knee past it, you get here, that's a 1. Things to point out for compensations here would be the movement or arching in the lower back. So if I have the space for one hand to fit in the small of my back as I'm doing this, great. If I do it and then that space disappears and now I'm like, my lower back's flat and pressing against the ground, I have now tucked my pelvis and flexed my spine as a compensation. So that would be considered a 2. Even if you get your ankles past, but you're rounding your lower back, that's a cheat. So that's a 2. This is also one that I think highlights some right and left differences quite nicely. And then I'm also going to have you guys, as you're doing it, imagine putting your hands like right on each side of your pelvis, and as you like lift one leg, do I notice there's a rotation or a twist in my pelvis? So do I twist towards the side I'm lifting? Now that's not considered maybe a compensation on the test booklet, but that is a quality of movement issue that I'm looking at to see how independent is this pelvis from the movements of the leg. So again, keeping that neutral spine, steady pelvis as I'm doing my leg lift, that's a sign for me, as I'm now going to watch this person get on the horse, that I'm going to watch for how truly independent is that pelvis. And then obviously there's a big, strong stretch potential here on the back of your thigh. That is the location for your hamstring muscles, as well as the posterior fibers of your inner thigh muscle group called your adductors. So it's not just a hamstring stretch. There's some adductors in there as well. And it's a big test of flexibility of the back, or the posterior aspect of your hip joints flexibility, the joint capsule, the connective tissue, and some of the ligaments that go from the hip joint to the tailbone and to the sacrum. Some of your pelvic floor muscles even have to be stretchy through some of their fascial connections. So there's a lot of like small things that can interrupt getting, you know, a 3 and only giving you a 2. But then let's talk like one other really big hard end stop to flexibility, and that would be nerve tension. So if you do this and you know, you're stretching this leg up and the stretch you feel is fairly broad throughout the whole thigh, that more or less tends to be tension on the back of the hamstrings. But if you do this and you feel more of like a string, narrow like structure going down the back of the thigh or even to the calf or the foot, that is more often tension along some aspect of, a nerve through your lower back, perhaps your sciatic nerve, perhaps some of the nerves that go into the calves themselves. So we then as physical therapists need to really tease out, is this nerve tension? Is this a joint issue? Is this truly just the hamstring that's tight? Because those are all big pieces of the puzzle to know what we're working on. If any joint or tissue like nerve tissue is tight, you won't ever get to a really good muscle stretch. And I put this lady's picture in here with the orange pants and the white tank top, because so many people do hamstring stretches and they're just rounding their back and tilting their pelvis just because they really want to get there to touch their toe. And it's not giving kind of credit and really being specific to the structures we're trying to get that are just from the seat bone to the knee. So I like this stretch, actually more like how the test is done. Or you can do this off of a mounting block, but really be careful about what you're stretching. So if this is the mounting block and you put your foot here, I'd have people relax their toe. Don't pull their toe up, because now that's taking tension on your whole set of nerves. So relax that toe down. And then you're going to bow at the waist without any movement in that spine. Think back to when you're on the floor. I don't want any moving or rounding of the pelvis or the lower back. So this is a relatively small movement for a huge, powerful flexibility challenge. And then if you turn away from that leg, you take your body, instead of pointing at that foot, turn 90 degrees away from it. Now you're going to get a stretch to the inner thigh. And I'll show you that as I change my angle towards the camera. So pointing and tipping towards this foot, relaxed foot, is a hamstring stretch. If I turn, now I'm getting it more through this inner thigh. And that's a great 2-for-1 exercise right before you get on the horse, especially that inner thigh stretch. So I guess at this point, I have to also go back because I neglected to go through the exercises that help if you struggled with the lunge or with the shoulder screen. So I'm going to go back to that in a second, in case anyone was like, hold on, what are the take-home ideas for that? But before I do that, any straight leg raise test or that stretch there, any questions? And if you noticed more nervy-like sensations, I'm not going to get into how to help that yourself, because you really do need to get to a professional before you start tinkering around with your nerves. Okay. So let me go back to this lunge. I was realizing, because there's one I wanted to show you guys on the mounting block as well. So if you struggled with this lunge, and this is nice, especially if you didn't get to that full depth of lunge, you could have, usually mounting blocks have like a first step and then a second step. I'd want you on that second step, being in this kind of semi-modified lunge position, and then just being here and trying to do 2 things. One, take a full breath, meaning chest fills, belly fills, and my ribs go wide. And then I exhale and all those structures kind of close and collapse back to their normal length. And then, second breath, can I also notice my pelvic floor dropping and filling with a little bit of that abdominal breathing room? And then on exhale, I'm going to contract and lift my pelvic floor up. And then you're going to try that all one more time. So full breath in all directions would be my first focus point. Exhale Everything comes back to resting position. Breathing in, pelvic floor fills down. And exhale. I can add a contraction, a Kegel or Kegel exercise as I exhale. And then I'm going to do that as I switch foot positions. So this is nice because if you recall, for those that were at the breathing talk, simply just focusing on your breath will instantly improve your balance capacity. That diaphragm, that dome that's here under our ribs, yes, it helps us breathe, but it's also coordinating our abdominals. It's linking into the lumbar vertebrae. It has connections to our hip flexors. So that diaphragm is a really powerful stabilizer. So I like this because it's, for so many reasons, it's secretly stretching your downside hip. You are in this position thinking about your breath before you get on your horse. So you're trying to downregulate your nervous system. You get to play around with a good breathing exercise of filling each space of my 3 regions of breath. I can play around with my pelvic floor and figure out how to turn that on and off. So it's a fantastic stretch / coordination exercise / nervous system regulator. So really, really nice activity. I'm going to leave it at that. We'll get back to the lunge for a different exercise in a moment. And then the shoulder flexibility piece. So if you guys are seated and just do some rib cage rotation, just left and right. This is nice because as I'm doing some of these reaches, there's a little bit of right and left rotation that occurs. So I'm going to just simply work on rotating right and rotating left. And because my diaphragm lives right here in the middle point of my rib cage, I'll inhale and exhale at the end of each rotation. So that's a lovely one to just simply, not just to pass a test and get a better score. That's a really lovely one to also take away that dominance of our right side, perhaps our right side dominance, where we always are a little bit right rotated. So I know if I'm feeling sore, tight in my mid back, the first stretch I'm going for is rotating left, because 9 times out of 10, that's the tighter direction. So seated, you can do that in the car. You could do that while on the horse. I have so many riders do a lot of reaching and rotational exercises while they're on, as that horse is just doing some warm-up walks. And then the other one that is really great, because part of lunges, if you look at the front leg, there's a 90-degree angle to that hip hinge that the gentleman has. So I'm going to create that 90-degree angle by being hands and knees. And then my rib cage rotation is going to be what I call a thread the needle stretch. I take my one arm and I imagine this little hole that I'm creating with my hands and knees position, and I thread the needle through it. And this allows for that hip hinge to be in place. It steadies and kind of, I'm going to say, like locks out our lumbar spine, so that when we rotate, it's really just the rib cage that can participate. And then I'm going to go the other way. What I'm also going to point out is when you do that rotation, so like imagine I'm hands and knees and you do that rotation. Some people find it better to look straight. Some people like turning. Sometimes I'll get into this position and I'll do like little chin tucks and just see if I can't get a little bit more extra stretch coming through this aspect of the shoulder stretch. So more into that upper trap fiber. So rotation, thread the needle stretch, both really nice for shoulder flexibility. And then you're also doing it in a position that's highly functional with that hip hinge. It's so funny because I just had my mom hurt herself in this manner. But how many times A physical therapist has heard this, where I was bending down and then I twisted, or I was down and I had to grab something and pull it. So being in that hip hinge and then practicing rotation is really good, because I know everyone's going to find themselves in a place to do that eventually in life. But let me also say, try not to, like, square up to the thing you're trying to push or pull or lift. Anytime you bend forward and twist, it's hugely risky for your lower back. All right. Sorry, I forgot about those. So we went a little out of order, but they were important ones to do. That lunge on the mounting block with breath in the pelvic floor. And then also having our rib cage rotation with breath at the end of each stretch. And then thread the needle. We have 2 more. And they are by far kind of taking us horseback riders outside this one right here, the trunk stability one, or just like a super, super hard push-up. It's really taking us out of our comfort zone and asking for our upper body to have a lot of strength. I don't feel like we need to have a ton of upper body strength in this capacity compared to, let's say, the military usages of this, or overhead athletes. They should be crushing this one. They should be doing really well. Horseback riders, like I kind of say, it's okay. But this truly challenges our ability to keep a neutral spine, because a lot of people do push-ups with very different shapes of their back, or they have their rib cage lift and then their pelvis lifts. And this is asking the whole entity of your spine from head to tailbone to lift up at the same time and lower at the same time. And that's incredibly hard. So the value of this exercise is that you feel how much your core participates for a neutral spine. And then kind of like, great, I did that. And oh, guess what? My arms are like noodles, which is usually what happens with riders. We have pretty good cores. And then we go like, but we can't get this push-up. What makes this push-up hard is, for females, the wrist has to be in line. For a 3, it has to be in line with your chin. And for a score of a 2, it can be in line with your collarbone. Where do most of us set ourselves up for? Really tucked in close for a push-up. But we have to be here for a score of a 2, here for a score of a 3. And if you're a male, your wrist has to be in line with your eye for a score of a 3. So that opening and that height, if you will, makes it a far greater challenge for that shoulder complex. How well can they stabilize and really engage those muscles that support a shoulder blade against the trunk? All of these guys. So if you're like, yeah, I'm going to sit this one out, at least try off of like a desk or a counter to do a modified version. You could even take the very chair. Give myself a little space here. You could take the very chair that you were using before, and at least just try being in this modified plank and practice a little bend of the elbow and a little press away. And notice that I don't want it to be that like I round my back and then my pelvis comes, or I drop my shoulders and then my pelvis comes or stays up in the air. So you're really trying to move your trunk and your pelvis at the same time. And that's what makes it such an amazing stabilizer for your core. For those that want to try this off the ground, I get to plead, I just had a baby, because that's true. So I'm only going to do this off my knees, but this would be a nice place for someone if they're like, I wonder how I would do it with those different hand positions. What I would do is lay down first, find the position. So find your wrists and either put it in line with your collarbone, or put one in line with your collarbone or one in line with your chin, and then kind of get back up, however you want to get back up, and then find yourself on your knees. So that's how you're going to find that end position, and just play around with that and say, do I feel like my spine and my like my lower back and my shoulders and my neck, does that feel okay? So that's a test of this position. But the actual real deal test itself, you start down and then you have to rise up all at the same time. And I'll show you what a lot of people do, which is head, chest, belly, and then the pelvis. And that's like way too disorganized of having a neutral spine. So you want to have it be where it all levitates at the same time. All I have to do is go up. So this test is just about pushing up. So we did the version where you're modified just off your chair, doing like little elbow bends. Trying it kneeling, and if you really want to be like screening your ability to do it first, lay down, get your hands placed either at collarbone or chin. And then one hand can kind of help you up and just be up. How do I feel while I'm up? And then the real deal test is you lay down, maybe you're going to try this off your feet or your knees, and then levitate everything at the same time. The head, the rib cage, the belly, and the pelvis all coming up at once. A 3, again, is like good form at the chin. A 2 is good form at the collarbone. And a 1 is any type of compensation, which includes kneeling or using the countertop. So a hard one to get a 3 on. That's okay. But find the value in really understanding that uniform coordinated movement of a neutral spine. What you can do if you're like, yeah, I can do it, but I can't coordinate. One thing I really like doing is having just some steadying practice. So holding my spine steady as I have some version of movement. And one way to do that is with a bridge. So kind of looking up instead of looking down, but this idea being that I want my pelvis, my lower back, and my rib cage to lift at the same time. I'm not going to go like tuck my pelvis, lift one bone off the like one vertebrae and then the next vertebrae and then the next and the next. Although that is an exercise you will hear in like different Pilates and yoga applications. But for what we're doing today, the chest, the belly, and the pelvis are all going to rise at the same time. And then they're all going to lower at the same time. So that's one way of practicing this sort of uniform stability in a different position. Another one I like is if you are in doing it like the countertop versions, that you're just going to practice little marches, like marching one arm up, the other arm up, little marches. And just that you're preventing any twisting. So now your movement that you're trying to avoid is twisting. Instead of like worming up or down, you're trying to prevent twisting as you do those little marches. So other ways of testing your trunk stability and ways to improve your performance on this test. We have one more. And this is where I think riders crush it. They do a great job with this one. Why? Because it's on so many of the, strong core for horseback rider exercises. It's just a very good common exercise that we see out in the world. And I think riders have really good ability to, in their motor programming, have a job for their right shoulder versus their left shoulder that's different from their right hip and their left hip. Like we can coordinate that many cues and skill sets. So we have a pretty good ability to, like I say, kind of delegate 4 different tasks at once. This exercise, the rotational stability, to get a 3, you're actually not doing what's called the bird dog. A bird dog is an opposite hand and foot that lift at the same time. To get a 3, it's the same side hand and foot that lifts. And then I'm going to also point out the reach you do is not up to the sky, but it's long. So it's a hand reaching to one wall as a foot reaches to the opposite wall. So you're trying to lengthen yourself as you do this. After you do that reach, this is where you're going to touch the elbow to the knee. And then you're going to reach again. So the actual movement goes reach, touch, reach. I'll show you that in a second on the table. Very, very great for balancing through the shoulder, balancing, through the hip, having a stable core while we're reaching, but now I need to have a core and a spine that's flexible for me to touch. So I need to be static and bracing for a split second and then moving the next second. And then, of course, as we ride, we use all these rotational muscles for turning to create bend, for changing up, doing flying lead changes. We need to have this real fine-tuned ability for our rotational stability. I'm going to leave it at that, and then let's do the test. So hands and knees. I haven't done this one post-pregnancy as a full 3 yet, but I'm going to give it a whirl. Maybe with the spotlight, I will do well. So we're going to start with a 2 that's opposite hand and foot, reaching to the wall in front, or a wall by your head and the wall by your foot. You're going to touch elbow to knee underneath you and reach again, all without touching the ground for balance. So again, it goes reach, touch, reach. Whatever arm is reaching is the side you're testing. So this will be a left score and a right score. So try the opposite diagonal, reach, touch, reach. And then for a 3, same side. Ooh, here we go. Reach, touch, reach. Da-da-da. And then you switch sides, reach, touch, reach. Now, this is the one that kind of tricky from a bird's eye view. You don't see it, but I guess you'll probably see a little bit if I do it like this. When you have, hold on, it's a twisty stool that my hand is on. So when you have same side reach, if there's a tip, or you notice how like my spine, if I had a Kleenex box on it, would slide the Kleenex box off. Technically, that doesn't matter. That wouldn't score you down to a 2. If you can reach, touch, reach, and not fall over, you get a 3, no matter how wonky and twisty your spine is. So I just wanted to point that out, because when we do this and we try to have good form, we usually try to keep our pelvis level, our spine flat, like a nice tabletop. Here, as wonky as you are, it doesn't affect your score. However, in like real life applications, when you're doing the reaching, I do want you fairly level when you're doing it on opposite diagonals. When you're doing the same side, so from same arm and leg, a little tip is inevitable. That's just what you got to do to counterbalance. Because I get that question a lot. What if I'm tipping? What if I'm twisting? Per the test, it's fine. But for a quality of movement that like a physical therapist eyes would want, the diagonal reaching, the 2 version, you should be perfectly tabletopped. For the number 3, same side, a little tip is okay. When we do this touching underneath us, this component or this component, you're concentrically, you're shortening your core muscles. It's like a crunch. And concentric or shortening contractions of our muscles are nice when we're trying to like create a rotation to the left. Half of my abs are crunching and shortening to do that. Half of them, 50% of the fibers. And then when I'm trying to slowly let that horse back out on the circle, I'm slowly and under control lengthening my core muscles again. Or we can think of it like I'm trying to turn really tight, and then the horse overturned too tight, and now I gotta just let go of the intensity of that bend. So all this shortening and lengthening control of our core is kind of tested here. As we reach, we lengthen our core. As we touch, we contract our core. And as we reach again, we're lengthening our core. So this gets at some of the different types of applications of our core strength as we are riders. Now that's just a rotational example. Following the pelvis of a horse during the sitting trot or during the canter is another version of eccentric and concentric that's happening every stride. Not something you can volitionally go like contract, relax, contract, relax, contract, relax. But I help riders find, is it more the contracting part that they're weaker on, or is it the slow relaxing, the relaxing under control that you're having a hard part on? So we pick and find which technique of muscle usage is the bigger struggle, and then we focus on just that during the sitting trot or the canter. So kind of how I can take this test and spin it into some more riding applications. So you can practice this exercise in and of itself. If you did it 3 perfectly, great. You're probably ready for something more difficult, which I'll show in a second. If you can't do a 3, practice the 2. If you can't do the 2, which is reaching opposite arm and leg, then just reach just arms. And then reach with your hands planted, and then just do the foot reaches. And then when you want to try to put it together, slide them on the ground. So you could put a towel under your hand and a towel under the opposite toe and slide them. Just do that slide. So those are all progressions within the position of the exercise. And then one that is harder, just don't want to tip my chair over. I'm going to get something heavier. Little bench should do. This is called a Palov press. You would anchor a band to anything between your shoulder and your knee, but ideally it would be perfectly at waist height. This is what I got. So even thinking like, again, the blanket hook on the door of your horse's stall, a doorknob on the door, it should be the doorknob on the other side of the door and then shut the door so it doesn't just like fall off on you. But a Palov press is going to test all these twisty rotational core muscles. I'm just going to press out and back in. And I'm going to do that in a bunch of varying foot positions to make it easier or harder. So I'm starting first just, 2 feet next to each other. It's going to give me the most stability as I do this Palov press. And then I'm going to try staggering. And you'll just feel your temptation to kind of twist back into the band gets harder and harder to resist. You might find you start to like lean and lose your balance out, or lean and lose your balance in. So you want to find it where you can feel that challenge, but not succumb to it. So holding level, no twisting. So squared shoulders, squared hips, and no leaning in and out, leaning in or out. And then you're going to go in line. And then eventually you're going to go to one leg, the outside leg. So those would be all really nice ways to practice stability. Now the movement part, because we need to move and receive balance feedback from our horse, would be, can I take like a forward step and then Palov press? And then can I go down into a lunge and Palov press? So now as I'm moving, can I take some of that rotational input? So stepping, pressing. You can do just the lunge by itself and then do the lunge and press. So these are other ways to incorporate rotational challenges into other activities that are probably going to improve your your hurdle test, your lunge test. It might even give you some newfound activity and motion control within your shoulder screen. So many of these exercises dovetail into each other really nicely. And that is where having it done by a certified professional who's been trained in it and has access to that app that they put the score into, like outspits your personalized workout routine. And it's usually not, 15 exercises long. It's really just probably 4 or 5 exercises that are going to vastly improve your performance on the whole test, but they're very specifically chosen. And that's great because no one wants to be like, oh, here's the 20 things I need to do. Okay, here's the 4 or 5 things I'm going to get to once or twice a week. So that is one next possible step. If you're like, this test is great, but I don't know like what my score is, or I don't know what I would have done. Is that really a 2 or a 3? I'm not sure. I can't see behind my back. Certainly let me know. There are many ways we can do this, whether in person or virtual. And you can also go to functionalmovementsystems.com. This is a functional movement screen, but functionalmovementsystems.com is where you can find a local, who knows what they'll be, a physical therapist, personal trainer, athletic trainer, and then you can do the test with them in person local to you. You just find a certified provider. And then obviously the work I do is not just this screen. It's vast and very uniquely kind of catered to whatever someone's goal is. But we watch how you move. We put your exercise needs as a priority first. And the hands-on care that I provide to my riders on site is really cool because it's not like it has to be a ton of work. I just am very particular about what I work and making sure it's the most effective place to work when I get, 15, 20 minutes to work with someone before they get on their horse. And then we video you, we have markers on the saddle and the horse's spine to really determine, okay, the horse's pelvis dropped and their rib cage rotated. Well, of course, you, the rider, are going to follow that. But if I don't know about the movement of the saddle and the pelvis visually very clearly, then I might be wondering, why is she leaning to the left? So I really get to watch each aspect, the horse's pelvis, the saddle and the rib cage, plus you in a nice reflective line jacket, back views, side views, slow motion video, and we get to then do other physical therapy exercises in the saddle. So that's a little bit of what those in-person sessions are like. The last thing I'll say, if you're at a farm that has a group of riders that you think it would be cool to do this little movement screen together, it's really kind of fun. You get some friendly competition, you all can laugh at each other, and it's good team building. But it also can take, a whole entire group of lesson program clients and make sure come April 1st, like we're all ready to go and start picking up and riding more frequently. So riding teams, that type of thing. You can do a lot of preseason screening, and it's just fun to do something as a group. So all cool ways we can take next steps with this type of functional movement screen for you equestrians.
Did you mention the program that we're putting on the 22nd of April?
Yeah, so the opportunity for the IDCTA riders is on the 22nd, and that is going to be open for 7 riders because you all get one-on-one private hours with me. So that is going to be a great day. And
you can sign up for it on the website under news on the homepage. So, and there'll be another e-blast that goes out probably early next week. So there'll be lots of ways that you can sign up to do that if you're interested, or as Allie mentioned, get a couple of the folks from your barn to come so that we have it'll be in Eagle, Wisconsin, And the specific address is on the website. So please take advantage of looking for it. And Allie, I want to thank you for this is the 5th one we've done. I think
Yeah.
all of them, yes, I think all of them have been very educational. I've had
Thank
lots of good reviews from the people that have been in the meetings and the people who have looked at at the videos we've done, even when I didn't do a perfect job on the videos. But so thank you all for coming, and thank you, Allie. This was very informative. I have to say, I won't tell you what my score was, but it was very low. I got a lot of work to do.
It's a humbling experience,
You
as
know-
most of my work with people is,
Yeah.
but it's all just good, maybe low hanging fruit here, maybe something unachievable, but it just gives you a cool objective way to measure your progress each year.
Are there any final questions before we close the session out? Again, this will be recorded. It won't be up probably until tomorrow morning. I sometimes takes me a little bit of time to get the information back for the from Zoom, so I can put it up on YouTube. So we'll talk soon, and thank you very much, Allie. And I'll be talking to you more about the clinic as we get a little closer. Thank you
Okay.
again.
Thank
Have
you,
a great night and take care. Bye-bye.
Bye-bye.